Well, we just had quite a set of speakers who went over a bunch of things that needed to strengthen the political will. But basically, we heard there is no silver bullet. There are multiple approaches that need to be tackled at the same time to increase political will. We need evidence. We need real stories. We need to involve the manufacturers. There's a lot of things that are needed to do that, and we need to have benchmarking schemes, and we need to have data, and we need to have people trained in capacity building. So I thought we had really a lot of excellent discussions today, and I want to open it up to comments from the audience, both here and online. Do we have any statements or questions? Miguel?
Well, thank you very much. First, I want to thank the comments of Murray and say hello. And after hearing these very interesting opinions, I think that the first thing that we have to underline, and I'm going to be very brief, is that the regulators regulate a very considerable proportion of the world GDP. Oh, so for Mexico is 10%, for Brazil is 14%, and so forth. So I couldn't agree more with Murray. You have to have technical capacities. That's okay, but you have to have managerial capacities. And you have to have these capacities in order to understand the challenge of the country in which you live in. And a common challenge is decrease in access to medicines or food in low and middle income countries. So you have to have the capacity to provide solutions using, for instance, the tools that you have in the world. Which kind of tools? As Murray said, if the medicine has been authorized by FDA, then why do you second guess that authorization, considering that the local patient has to travel to the US to buy the medicine? And that will increase the costs in 400%. And the purchasing parity of that consumer is very different. As we say, maybe in Honduras, the income per capita annually is around, you could say, $900. And in the US, that is 20,000. So why the citizen of Honduras has to face this challenge in terms of access? Because the local authority is second-guessing FDA, and they will take 5 years in order to authorize the local medicine. So that's the real story here. So the regulator has to have that capacity in order to provide solutions with these kind of tools. And also, along the way, I don't think that there's no conflict of interest if you provide the tools for your local manufacturing to adopt these international standards. So that's my point of view. And if you do that, I am sure you will create political will. Thank you.
Thank you. Do we have any other statements? I'm looking at Carlos. I figure he has one.
Okay, thank you very much. This is a very interesting discussion. One question to Murray, and I would like to discuss a little bit with Javier one of his points. Murray, you briefly mentioned the legal framework, and we have just touched the legal component of all this. You mentioned the importance of regulation to be considered within the overall health system. So we are talking eventually about legislation in relation to the health system and how that reflects the policy and the structure. And that's your emphasis on organization is important. So what would you see as the strategic investment that we all should do to really increase this legal strength as a resource for regulation? What Lee Hong was talking about was, this dispersion of authorities. Legislation should take care of that. So, can you explain us what would be your perspective on this? And with Javier, I think that when you say it is very hard to identify, or it's not possible, or it's very thin, the relationship of regulation to the health impact, it is because I would say we have not developed enough designs, the regulatory science within the public health framework. And I think you are identifying a main handicap that we have. And we really have to make the linkage of this public health function, it's a public health function, to the health impact, the impact of the people. Do you see any hope for this, or your statement is that basically you see that this is not something possible?
Thank you. Sorry?
Go ahead.
Okay, sure. Thanks. Thank you for the question. I think you bring up a very critical point, and that is creating the enabling legal environment in which many of the things that we talked about can actually happen. And I would say, as Margaret pointed out this morning, this was attempted and is still being attempted in Africa through the AU's model pharmaceutical law. But basically, you want a law that does several things. One, that mandates that the decisions must be science-based and not politically based. You have to have something that in law says that the agency is independent and is able to make science-based decisions, that the agency is adequately financed to do that which it is asked to do, and most importantly, that the legislation recognizes and enables the agency to use these various reliance techniques that we talked about to inform their own decision making. And I think one critical element of this that we continue to find out, and particularly, for example, in the Caribbean recently, is that you can only do reliance if you are getting the same version of the product that the agency that you're relying on actually took a look at. And what we find very often is that the version of the product that a company sends to Europe or sends to North America is a different version than what it might send to other parts of the world. And that different version is made in a plant that the FDA or the EMA never went into. So one of the real value adds is for countries to understand how they can verify. And when we were talking about transparency earlier this morning, this is one area where greater transparency between agencies would be absolutely helpful and mandatory, is to be able to verify that you're getting the same version, so that when your legal framework allows you to rely on what another agency has done, you have confidence that indeed you are looking at the same version of the product that the other agency looked at. So that's what I think we're all trying to have occur when we talk about having an adequate legal framework for these different activities to actually occur.
Thank you.
Sure. I think the relationship with even the most comprehensive target that we currently have under the Sustainable Development Goal, which is the target on universal health coverage and access to safe, effective, quality assured, and affordable medicines, is not direct. I mean, maybe it is direct, but there's no causality there, and it's very difficult to include causality there. It's a prerequisite to have safe, effective, quality assured medicines. Then when you add the availability angle, that's basically supply chain. That's not related to your regulatory system. When you add the affordability angle, then it's got a lot of components beyond the regulatory system, out-of-pocket payments and everything else. So I guess you can make the case this will help you achieve this target. And it's the first time the countries in the world are actually measuring the target and reporting on the target. If you look at the Millennium Development Goals report, no target on access to medicines was measured. So it's the first time the Sustainable Development Goals is going to have to measure the target. But the target is not a direct link with the regulatory work. Of course, you can make the case. The quality, the safe, effective, quality assured is key, but it's only part of it. So that's what I'm saying is not as strong as you'd like it to be. I just wanted to talk about, so I guess, just to finalize, yes, I think we do need to think about messages and metrics that will basically resonate within policymakers. And I liked the story, telling stories, as you said, or what Lou was telling us about this morning, a face and a voice for regulation. Because I think selling it as part of a functional health system or as part of, a requirement for governments is just not strong enough for politicians and policymakers in a lot of countries. Now, just wanted to comment on something Mikkel said about second guessing the FDA, and just wanted to put something on the table. I think it was great to have the recommendation on the legal framework that is explicit about collaboration, that is explicit about the possibility of reliance. I think it's great to have the global benchmarking tool asking people to be public about the reliance and about your regulatory decisions. And we heard about the Ghanaian experience this morning. But there is one difficulty there. We talk about FDA-approved medicines. But increasingly so, FDA has different ways of approving medicines. So we have breakthrough innovation, we have accelerated approval, we have, different ways of approving medicines. And that's basically because the FDA does have the ability to get data once the product is in the market. So post-marketing approval data. That's not a luxury a lot of countries have. So when you get to countries and you need to tease out all these details and then adding up what Mac was talking about, which is making sure it's the right product, and you don't have information from the stringent regulatory authorities about that product. You don't know the factory it was manufactured in, you don't know the address, you don't know the details. So then reliance becomes more difficult, and it becomes a kind of like a blind exercise, which I think is very difficult to do. Thank you.
Do we have any other comments? Lee, do you want to add to it? Okay, anybody else online? Oh, sorry, Maria?
Thank you very much. Just first of all, thank you to the National Academy for this nice report, because it combines a lot of information that is not easy to find in a single piece of document. And it's very interesting to see how all the efforts that has been in place in the region or at global level are summarized and are presented in this way in the report. I do have, it's a comment or question, I don't know, for Murray. And he was mentioning about the need to address a challenge regarding the operational capacity of regulatory authorities. And I'm really interested in knowing, is there any experience or any leader at global level today that he knows that could share on how to address and provide this type of cooperation, because we have seen in the region of the Americas that there are just few leaders in regulatory authorities that have made the case. And you have two here in the room, Javier and Mikel, that made the case in their countries to get the political commitment to strengthen regulatory capacities in different views and considering different elements. But we haven't found at PAHO any good counterpart to provide this type of cooperation to the leaders of the regulatory authorities to address the operational capacity needs for that convincement of the political will. And my other question is to Javier, and is regarding to the last argument that he mentioned and summarized regarding when regulation is done properly, it is not in the news. And we have seen this in several authorities, for example, that has been considered either strengthen regulatory authorities by WHO definition or national regulatory authorities of regional reference in the PAHO region. But today, what will be the message for those NRAs that are not yet there to continue making the case and to being on the news, but for good practices instead of for lack of regulation or lack of regulatory oversight, which is always criticized at country level? Thank you very much.
Okay, Murray, do you want to give the first question?
Yeah. You know, you bring up a very critical issue here. And as I tried to say when I was making that point, we've been involved very deeply with two countries on this issue of operational capacity. And it has been very difficult to find one organization that can meet the various needs. We've had to basically put together ad hoc, bespoke programs where once you identify the particular operational capacity needs, sometimes it's twinning the leader with the leader of another agency so that they get the executive input and the executive strategy. It's finding people with the financial background to look at financial sustainability and what might or what might not work. Looking at people with the legal background to look at some of these legal issues and policy issues about how you integrate reliance into the way you do your business. And then, you know, people that are involved in change management. So, you know, there's not one group that does this. It's, you know, we're finding this is an area where there is great need. I would be delighted to talk with you further, and Mary Lou and people at PAHO on what our experience has been. But really, to this point in time, it's been very much an ad hoc, bespoke, trying to put together a program to meet specific needs in specific countries. Thank you.
Thank you. And the second question, Javier?
Yeah, I think legitimacy and public trust are very important assets for regulators. I think are the essential assets for regulators, and that's very hard to get and very easy to lose. After years of work, a single problem could actually get, you know, your legitimacy back to where it was 10 years back. So I think the way to, you know, be in the media and communicate to the public and create that trust is to do so when there's no crisis. And I think there are many ways. One is, you know, campaigns, basically campaigns promoting the importance of safe, effective, quality assured medicines. The campaigns promoting the importance of looking at products, making sure products are registered, and campaigns basically talking about whenever you have a side effect, you can report and there's investigation about it. I think illegality, as I said, is a big one. So if you see the regulatory authority enforcing, the making sure that illegality is not there, and you see fines, you see enforcement there, and you make noise with the enforcement, well, people will realize that there is an authority there. But of course, it's key to reach out to healthcare professionals, to all the different stakeholders, because if they don't trust on the authority, nobody will. It takes time. I think it's very difficult, but it's something that regulators and we should all do when there's no crisis. One interesting example I could think of is, showing things that people don't know, like, for instance, how you test the quality of condoms. So I remember, the need, there was a TV journalist coming to our lab, showing people how condoms are tested. They're filled with water, and then you get the air in, and then they, all that stuff. People don't think about, quality assurance in that way. So it's kind of like bringing down those elements of regulation to people, so people think and feel that someone there, an agency there, is watching out for them. Thank you.
Thank you very much. I think we have a short break, or do you want to just go straight to the next section?
I think just in the interest of people's schedules, we might just go straight into our closing speech.
Okay.
But I want to thank you and Emma.